Hey guys, it's Wynn, your friendly neighborhood pelvic floor therapist. I wanted to talk to you today about your pelvic floor, what it does for you, what's normal, what's not, what can go wrong, and what you can do to fix it. Okay, so this is your pelvic floor. These are all muscles inside your pelvis here, and they're really important. They're involved in a lot of different systems. I like to say that your pelvic floor is on a lot of different teams. So your pelvic floor is on the peeing and pooping team. It is on the sex and babies team. It is on the digestion team. It is on the breathing team. It is on the circulation team, so both your blood and lymph circulation. And one of its most important jobs is it is on the team that stabilizes your pelvis and your spine. Now, if you think about most of those things I just talked about, they're all automatic, right? You don't think about your breathing, you don't think about the blood flowing through your body, so you don't think about your pelvic floor muscles that much. They just kind of do their thing. So when something goes wrong with them, you don't usually notice until the symptoms get really bad, and that's when you might be going to your doctor and talking about some of those symptoms. So we are going to talk about what some of those symptoms might be. First symptom that you might notice, the one I see patients for the most commonly, is incontinence. So leaking pee. There are a couple different kinds. So there is stress incontinence, where you leak when you cough or sneeze, or like you have to cross your legs when you're laughing really hard with your girlfriends. That is stress incontinence, and that's usually an issue with the muscles. So either that they are weak or that they're too tight. Another kind of incontinence is urge incontinence. So urge incontinence is when you leak on your way to the bathroom if you feel like you have to go. Sometimes it's just a dribble, sometimes it's just a complete gush. And along with those two is overactive bladder. So that's when you're going too often during the day. Another really common pelvic floor symptom is problems with your digestion. So a lot of people come in complaining of constipation. A lot of people have diarrhea, or they might have both and have been diagnosed with irritable bowel syndrome. So what is normal? Normal is pooping either every third day up to 3 times a day. But what's really important is what the poop looks like. So it should be a 4. Yeah, I've got a chart about poop. Another symptom that I hear a lot is pain with sex. Often people have been told it's just because they're dry, but then they try lube and it doesn't work. Well, guess what? You're not dry. You probably have a problem with those muscles that we saw inside the pelvis. Those pelvic muscles are on the team that stabilize your back and pelvis. So a lot of times I get people in here with back pain or hip pain, and usually there is some pelvic floor involvement there, especially if you've tried other treatments like yoga or tried physical therapy before, the chiropractor, and either nothing works or it doesn't stick. Like it helps for a little while, but the pain always comes back. You're probably missing a pretty important piece, and that would be your pelvic floor. Other symptoms that I often see are headaches and neck pain. Because your pelvic floor is involved with your breathing, if the pelvic floor isn't working right, you're going to breathe differently. So you're going to breathe with your neck and your shoulders, and that can cause the neck pain and headaches. Another one that I commonly see is swelling in the legs. If you have any of those symptoms, your pelvic floor might need a little pampering, and you might need some physical therapy. Most people don't realize that there is physical therapy for the pelvic floor, and it might be a little scary when you first think about it. I've got a whole nother video on what would be involved if you came into therapy for your pelvic floor. So if you're wondering about that, go check that out. Basically what we would be doing is asking a whole bunch of questions to see what's going on with you, and then checking those different systems, your breathing, your muscles, muscles, that sort of thing, to see what's going on, and then coming up with a custom program for you with exercises, stretches, that sort of thing to get you better. The good news is that all of these things are super treatable with physical therapy. There are tons of things you can do to make these better. You don't have to live with this stuff. So it's really a common belief that if you've had kids, that the stuff is normal, that you're just gonna leak when you laugh or cough, and that's not true. It's common, but it's not normal. Think of it kind of like back pain. I'm sure you know a lot of people with back pain, but you know it's not normal. It's common, not normal. Everybody's trying to do something to fix it, right? Same thing here, just a different body part. If you want to come in for therapy, what we need is a prescription from your doctor. Some insurances will cover it without a prescription, but most of them do need a prescription. And then you can call our office, Thunder Bay Therapy and Sports Medicine, at 358-8086 to set up an appointment with me, Lynn. Or if you have questions, you can call and leave me a message. I'll call you back, or you can email me, and I will get back to you. Thanks for listening, and have a great day.